All right, my name is Beth Marshall, and I am the Associate Director at the Center for Adolescent Health and a member of the eSchool Plus team. So thank you for joining us today. On behalf of the members of the eSchool Plus initiative, I want to officially welcome you to the fourth and final session of our second eSchool Plus webinar series, Mental Health and Social and Emotional Learning in School Reopening. So our goal for this session is to explore how and why reopening schools has become a highly charged issue for students, and to consider what this may mean for equity, learning, and schools as now more students express the need for mental health and social and emotional learning supports. We'll also explore some of the enormous hurdles that K-12 schools across the nation continue to face in supporting students in this area in the midst of this unprecedented pandemic. As we've seen, the challenges of reopening have been divisive, particularly for families of color and schools serving large populations of vulnerable students and students with mental health needs. So what is the long-term impact of this pandemic on providing services for students with mental health needs? To help us answer that question, today we have invited some of the foremost education practitioners and researchers as experts to discuss this topic in a complex, changing, and highly consequential landscape. So I want to first introduce our panelists. I'm going to start with Holly Wilcox. Welcome, Holly. Holly is a professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health with joint appointments in the Department of Health Policy and Management, as well as the Johns Hopkins Schools of Medicine and Education. Much of her work involves population-based research on suicidal behaviors, the impact evaluation of community-based universal prevention programs targeting suicidal behaviors, and data linkage to inform suicide prevention. She's involved in suicide prevention research in schools, universities, emergency departments, and other settings. She mentors students, teaches courses in the Johns Hopkins Bloomberg School of Public Health, and leads a multidisciplinary interdepartmental suicide prevention work group at Johns Hopkins. Thank you for being here with us today, Holly.
Thank you for having me.
Next, we are really honored to have with us Karen Weber, who currently serves as the Director of Education and Youth Development at Open Society Institute, Baltimore. Previously, Karen was the Executive Director of the Office of Student Support and Safety at Baltimore City Public Schools, where she worked on policies and practices that contributed to school suspension and expulsion rates decreasing dramatically in city schools. Before moving to this position with the district administration, she served as a principal in Baltimore City School. And prior to her career in education, Weber earned her law degree from the University of Texas School of Law and focused on civil rights. She also served as the executive director of Open Housing Center in New York and the Public Justice Center in Baltimore. We are really pleased to have you join us today, Karen.
Thank you so much.
Finally, last but not least, we have with us Peter Kannam, who currently serves as the principal of Henderson Hopkins School in East Baltimore. Prior to this, he led a project around Race to the Top, which convened reform-oriented state leaders and best national thinkers in K-12 education to develop concrete reform ideas and successful strategies around the federal competition. He previously served as Executive Officer of Government Relations and Public Policy and the Executive Director of the New Leaders for New Schools Maryland for 4 years, which is where he launched programs in both Baltimore City and Prince George's County. He also served as the Executive Director of Teach for America Baltimore, and he began his career as a teacher and taught 8th grade social studies through Teach for America in Baltimore. We're very lucky to have you here with us today as well, Peter.
Hi.
All right, so to our audience, quickly, just a few guidelines about our discussion this afternoon. I'm going to start by asking each of our panelists one question to get the discussion started, and then I'll be directing a series of prepared questions to the entire group for consideration. But we do want you, our audience, to join in too, so you can submit questions by pressing the Q&A button, which is below at the bottom of your screen, and you can upvote someone else's question by clicking the like button. We'll incorporate as many questions as possible, and we'll start with our audience questions about halfway through today's discussion. Again, Welcome to everyone, our audience included. And we're going to get started with you, Holly. So I was hoping that you could talk to us a little bit as a researcher in suicide prevention. Tell us about this pandemic and how it's really impacted the mental health needs of young people.
Thank you. Well, the pandemic has in some respects been the perfect storm for folks like myself who spend a lot of time working to prevent suicide and other mental health challenges. Part of it is due to the social isolation that we've all been experiencing with physical distancing and mitigation measures in terms of spread, but also thinking about the economic impacts that many families have faced, job loss, housing concerns, and everything that goes along with financial hardship. So those have been other things. There, at the beginning of the pandemic, there was record firearm sales. This is another thing to me that is extremely alarming because the accessibility and availability of firearms with young people struggling with depression and other mental health concerns and in easy access is a real major concern. Often too, like the new firearm owners may not have the skill set in how to properly secure their firearms and lock them up. And so that's another major issue. Also thinking about limited opportunities for seniors, sports being canceled for some students or other activities which they look forward to. So not having as much to look forward to, and the sensationalized media and hearing about other people struggling constantly can get under your skin at some point. Access to care for those who have mental health concerns has been a problem, and face-to-face visits with their providers. Sometimes it was hard to do those online, and the Zoom fatigue as well. And bereavement from losing friends and family and other people to COVID-19, interrupted routine. And so you guys can get a sense of the burden that this has created on all of us and how especially this can affect young people.
That is a lot for young people to be bringing back into schools as we're reopening. So I'd like to turn to Karen, who you have a really long history as an educator and a district leader, and now as Director of Education and Youth Development at OSI. What do all of these challenges that young people are bringing back into the buildings, what do you see at a systems level as we try and sort of grapple with this in terms of meeting these challenges around mental health and social and emotional learning?
Yeah, thank you for that question. And challenge is the word. It's definitely going to be challenging, and we don't know all of what to expect because we haven't been through a situation like this because we weren't around in 1918. But we already know with partial reopening that there's a lot going on. Students have had a lot going on in their lives, and we spoke of losses and mental instability because of routine instability, food shortages. They've faced just more than we could really imagine. And especially I want us to think about the fact that approximately 85% of our students live in poverty. So there was already an over-reliance, if you would say, on the bricks and mortar school. Mental health services were there, regular health services were there in many instances, food services were there, and some type of routine and ordinary type of lifestyle. And with that being removed for in excess of a year for many children, because all children are not coming back right now, that's going to create some real, I think, disconnects in how children perceive school when they come back. One of the things I wanted to mention too is that there are some children who have not been seen or heard from since last March. and what's going to happen to try to get those children back. And when we do get them back, what are we going to be facing? One of the biggest challenges, I think, is with educators. Our job is to educate students. So we usually put that first and foremost. In this instance, though, we're going to have to lay groundwork to make students feel at home, to feel comfortable, to feel safe, to have enough to eat, to feel cared for, to feel wanted. We want you back here. And that's not necessarily been our strong point. And the other thing is that educators are in such a panic about learning loss that I think too many districts and too many school systems are just going to dive in with, we've got to ramp this up. You've got to catch up for everything you lost in a year. And that's completely unreasonable under the circumstances. The brain is a magnificent instrument. And with the proper supports and care, the children will catch up. I think we have to be confident about that. But they won't catch up if they're not feeling comfortable. And some of them will vote with their feet and not be seen again. So we have to really do sort of an embracing of our students. And of course, you know, I'll speak about it. I speak about it wherever I go. I think restorative practices is one of the best ways to do so. Happily, the Baltimore City public school system has adopted restorative practices, and school by school, they're being trained and it's being implemented. What we wish, of course, is that every school had that tool available and had that knowledge, so that when kids come back, they're sitting in circles talking about what happened to them, how they're happy to be back, so that their voices are heard and we can respond to the needs that we may or may not see. So I'll stop there, but I sure have more that I could say.
I muted so you didn't hear my dog barking. We will come back to you so that you can say more. And certainly the juxtaposition of talking about restorative practices versus sort of everyone coming back in and we're trying to make up learning loss right away. You can even feel that difference in just hearing you describe those two different approaches. So now, Peter, I want to turn to you. You also have a long history as an educator, but you've got a really unique perspective as the principal of Henderson Hopkins, because you have been meeting your family's needs since the first day of the pandemic. And so I would love to hear you talk about what you're seeing in terms of what's going on the grounds with mental health and how it's affecting these students and your families.
Yeah, well, thank you so much. I want to paint a picture of a middle school cafeteria from today, first day back for middle schoolers. And I can't tell you how excited I was to see my guys and my young women back. It's just so wonderful. And if you had come last February before the pandemic to a middle school cafeteria, you know what it's like. It's loud. It's like, I do not have quiet cafeteria. I don't promote that. The kids are talking, they're cracking on each other. They're having a good time, right? Now fast forward to today. And it was eerily quiet. There were 16 eighth graders there. There were plastic sheets up in front of them. They were in lines quietly and then sitting down, going over procedures of washing hands and getting their stuff, and all very relevant and like that we had to do, right? But then I literally had to say, guys, you can talk. Like, look, this is the one time that you can talk. You go for it. Like, and it got so quiet that I said, I rolled in a speaker and started playing Bruno Mars for the kids, you know, just so they could relax. It was like a level of anxiety, like first day jitters, but also like the recognition, like the social interaction piece. It felt like kids were stunted. And it was very odd, but they're going to get used to it and they're going to break out of it, but we got to help them break out of it. The other image I want is what I call cameras off. One of the biggest challenges for teachers and students are cameras off and people are on mute. And look at attendance figures across the city. Oh yeah, we're in the low 90s. Are we? Are kids on? Are they engaging? And my big thing as a principal is, do we really know? Do we know? You say how mental health is, do we really know? Well, look, our attendance is this, are kids actively participating? And the greatest challenge for teachers are they don't, even though students are on, they don't know if they're on, right? So the big push is to really understand where every student's at. Like, how are they doing? Checking in with them, making and understanding where they are, not just looking at grades and attendance, but really, truly understanding where they are. And so, and that's a real big push. I mean, we have 50% of our kids at Henderson Hopkins have come back in person, 50% are staying home. I know we made that a choice. It's much lower across the city. So how do we really know how students are doing when we got to check? When it comes to it really is pulse checks, check-ins, knowing where every student's at, making sure we're calling families and we can really track every student, and then really arming teachers with what we rolled out was an evidence-based social emotional learning curriculum. I mean, we use Second Step, which is but that's one of many that you could use, but it's not so much about a curriculum. It's about, as a principal, giving teachers time to train on a curriculum and then time during the day that it becomes prioritized. And we've been working through lessons, with and follow-up, lesson once a week with 2 follow-ups, and, around empathy and problem solving, anger management, things that our students need in this time. But to me, we have to be proactive. I don't want to assume all of our kids are going through all this incredible trauma too. Like that actually kind of upsets me too. Like, oh, the poor Black kids in Baltimore City are all going through all this trauma and they're all messed up. So we don't know, but we have to understand. We have to. Yes, there are major stressors that our students are dealing with. We have to acknowledge that. We have to actually meet every student where they're at, understand where they are, and then set up resources and support for their families. And one proactive way to do that is to build in social emotional learning time into the curriculum, which we're doing. So happy to talk more about that as well, and anything else that the group wants to discuss.
I would love if Karen and Holly, if you want to weigh in and sort of follow up on Peter's comments, because I think, you said a lot there I want to follow up on, but both that we don't know. And so we need for teachers and for school staff to be able to identify issues when they're there and to be able to address them. And so just, you identified using an evidence-based social and emotional learning curriculum as one method. And if others want to weigh in just on what are the things that we need to do, and are teachers sort of across the board prepared and ready to handle this? And if not, what do we need to do?
Yeah, I wanted to weigh in, and I'm 100% in agreement with what Peter is saying. And this idea of letting teachers have some type of tool that helps them get to students, because it's not a natural. You don't just walk in and you're 30 years old and know how to speak to somebody who's 11. That was a long time ago. So having tools in place is absolutely essential, and prioritizing it. Those are 2 key ingredients to seeing where your students are. And one of the things I wanted to say is that, and I've made this point before, is that all the kids who are in need don't always jump up in your face and let you know that. Some of them are very quietly sitting in a corner at their desk, but something very terrible might be happening to them. So by having these check-ins where you're individually checking in with the children as a group, you can flag where troubles are arising, and sometimes even other students will tell you what's happening with a student that you can pull aside and connect with mental health resources. But the only place I disagree, and I think we can do this because we're friends, but the only place I disagree with a little bit, I totally hear what you're saying, Peter, about let's not make it that everybody's, these pitiful Black kids, they're poor, they're this and that, because they're used to being more resilient than I've ever been in my life. And so that's a truth. But the other thing, though, is that I'm thinking in terms of every single kid who's walking back into school in September, we've all been through something. And the other group that has been through something are the teachers. everybody's not lucky enough to have a principal like Peter, who understands that his major role is to support the adults so that they can support the kids, and then to check and see how everything's going. But if those adults are not supported, you can forget about whether or not the kids are getting what they need. And so the next question is, what systems are in place for teachers to have what they need? Some of them may be next year still teaching kids in front of them and children at home. And like, what kind of scenario is that? I do want to put in a plug for Baltimore City Public Schools, though. I just spoke to an official today who says that they are planning right now about how they're going to roll out some of the practices that people are most familiar with, including restorative practices, or mindfulness is happening in some schools, and to make sure that that's pushed up as some of the first interactions that adults are having with students. And I think that'll make a difference. It won't be everything, but it's definitely the way to start.
If I can jump in, I agree with everything everyone said, and I love it. But one thing I've noticed in times like this, there is somewhat of a need to be more proactive rather than reactive. So I think it's safe to assume that there will be some students who will be in crisis or will have a lot of difficulty with the adjustment of going back. And having protocols in place and programs to be able to know exactly what to do if there's somebody who's not safe, either at risk of harming themselves or, of being harmed at home, and what exactly to do and when that does happen. And so there's the need more for that now than ever, I believe. I mean, there's always a need for that, but taking a more proactive than reactive stance to the mental health potential burden that could be disclosed.
Thank you. I want to, another piece I want to follow up on. Both Karen and Peter touched on the kids we're not sure about. Some of them we haven't seen at all. Some of them are on Zooms, but they're in black boxes, which is their names printed, and we don't know what's really going on there. And so folks have, said nationally it's potentially up as high as 3 million folks that we've had completely disengaged from learning. And that's not including the ones who are logging on, but are still potentially disengaged. And, they suspect that there's probably, like we've been talking about, a lot of mental health challenges. And as we see schools reopening, we see disparities in terms of who is voting with their feet to come back in terms of race, ethnicity. And like you mentioned, Peter, you're at 50%. That's not necessarily what we see at every school, both in our district and, other districts across the country. So what programs, what types of assistance, what do we need to do and think about both at a state level, at a district level, at a school level, when we want to try and meet the needs of these students?
Maybe I'm next. I saw you guys. People matter, like in a school building. Like I have a full-time mental health clinician through Bayview Partnership. So barriers to access is real, right? Like families, when we can talk about the kids in crisis or we're worried about, right? Because something percolates up. So we have to be in touch with families. But when I reach out to families and we offer support, I'm telling you, they're like, thank you, Mr. Kannam. But navigating the systems to actually get services for our students is very not only cumbersome, it's overwhelming. But so like literally having the systems in place, having a guidance counselor who doesn't just service 20 to 25 kids, but actually does systemic guidance counseling. I see as a team of adults that we've been able to set up here, including a mental health clinician. So when things get surfaced up from teachers that, this child really isn't responding or engaging, and having a professional be able to kind of talk to the parent and have a conversation with them. We have that ability to kind of be the first line of defense, but it matters to staff up. Like we have to staff up around this. Yeah, there's two things that have to go on simultaneously, I think. Like, one is staff up and have like the right professionals in a building to do the crisis stuff, right? And it's not just all them doing the services, it's having the right social worker connecting them to the right resources that are in the community, right? But then it's really training our teachers on how to actually become social emotional like managers and practitioners, that they know how to, exactly what Karen said. It's using, whether it's using a curriculum, and we're building in restorative practices to train our people on how to do that well. So it takes people and resources to do that strategically spent. And this can't be an add-on, like this is something on the side. It's really kind of, it's central to our core learning. So I really think about it, it's kind of come up in this conversation as what's proactive investments that you make. And then, but absolutely, I mean, we need to do this before the pandemic, have the crisis infrastructure in place. And that requires people and know-how as well. So it gets down to some right people and resources.
The other thing, totally, Peter, and the other thing I wanted to say is one of the dangers in any large structure is it's not my jobism. So we have a re-engagement center and they do a great job of getting kids back. But how many kids really, realistically, can they get back? And so what Peter's saying is resonating with me. It becomes everyone's job to get kids back. It becomes everyone's job to welcome them when they come back. It becomes everyone's job to stay in contact with them throughout the day to see how they're doing. And I don't think that mentality has really set in as the way we do business yet. We're still trying to shake 1950s, where all I have to do is come in and do the little piece of job that is my job. But that's not how school communities operate in 2021, and especially after a pandemic. This is everybody's job. Everybody's going to have to be engaged in trying to get children back to school and being okay. One of the things I wanted to say too about the students who have disengaged, there would be a belief that they were all high school students. They're not. Some of them are little elementary school children. And so where are they? What are they doing? Now, I want to say too that some of the high school students have walked down the street to Amazon and gotten, $15 an hour jobs. And so how will we build around them? They may need that job. So how are we going to put supports in place to make sure that they still can finish their education? So I think all of these discussions are being had, but at the same time, what Peter's talking about, every school doesn't have the plastic already set up and the hand washing station and instructions on how to do it. Some people are really scrambling just to get the basic safety in place. And so some of these other issues may be missed, and that's really the concern.
Thanks, Karen. I think, sort of the theme is all of these other things that now educators have to be experts in, whether it's ventilation or hand washing or space or mental health needs. It's leaving a less time to focus on what folks probably entered the profession thinking their main role was to be. I want to shift gears just a little bit and talk about the families, and particularly if you feel like the role of parents for students who have mental health needs or need social and emotional support, like has that shifted over the time in this pandemic? Are parents needing to advocate for those services more, which have become slightly more scarce given the need and demand? So how do you see the parent's role over the past year?
Is it okay if I jump in first?
Mm-hmm.
One thing that was somewhat unexpected that has come up as a concern, and we talked about this a little bit earlier, is the readjustment. And there is a subset of students who, now that they've been home, over this past year, are really wanting to stay at home, and their social anxiety has increased so much that it's become a barrier to them thinking about reintegrating back into school. And so there's, some parents who are struggling with this now is like, how best do I coach and support my son or daughter to get them back? And we all thought they would be dying to go back to school. I'd be dying to get out of this house, but that's not the case. And so it's an unexpected, in some respects, situation to be encountering. And, feeling off our social game, because we've all been so isolated lately, and the kids especially too are feeling that way. And so it's a new problem and a new challenge that we're facing. And in terms of our healthcare system, that's one thing we're seeing quite a bit of too, is, this transition back to school and how much stress that it's actually putting on students and their families. So it's a new challenge to have to face.
Did you want to jump in, Peter, or should I go?
You go, then I'll go next, Karen.
Okay. Yeah, I was going to say, some students, what I'm hoping is that this will change how we do school. There are some students for whom doing school from home would have always been the best way to go. Some students are doing exceedingly well, not having to deal with some of the social pressures, especially in adolescence. So I'm hoping that will be somewhat of a shift, that we'll be able to continue to have those mechanisms available for those students. But the other thing I wanted to say is that the issue with families is that they haven't been spared either. They also have been trying to juggle children. Some have had to go into workplaces before the pandemic, before we even had vaccines. Many women have left the workforce for this very reason. Are they going to be back? Are they going to be readjusting to going back to work while the child is readjusting to going back to school? So it's a very complex set of circumstances. It's no longer just looking at like how are families supporting children, what's happening to the family, and then who is supporting the family and who is supporting the children, who's supporting the teachers. It's really a circumstance where everyone is going to have to be given some grace, because everyone is going to need some support to readjust to whatever it is that they're going to have to face.
Yeah, it's just from parents, it's a lot. There's a lot going on. And if you're now managing, you're working 2 shifts, or like I have many people working, they're workforce employees. They've been in person since day one, and they're now managing a Zoom schedule. And it's just kind of helping, like they need help, like in support and clear communication. And something that we haven't touched on, which is a stressor in my community, is the racial stressors. George Floyd and the social unrest. Kids have a ton of questions about that and what's going on with the trial right now and some other issues that are happening. I mean, it is front and center on our mind, and we have to talk about, basically racial justice, inequality. And that's a huge stress. And guess what? Teachers are stressed about it and are angry and upset. And their kids want to, and how do we talk about that? And how do we arm people on top of a pandemic, on top of all these other, it's like, it becomes at times overwhelming. And parents have said to me, Mr. Kannam, like, how do we help? How do we process it all? And so parents have been great. They're just real honest about being overwhelmed. They're just overwhelmed. And and half my parents are saying, you know what? I need them. I'm very worried about their grades, their participation, and their social interaction. So I'm bringing them back. And the others are just really fearful of the health concerns. And so they're not ready for either getting themselves or their members of their family ill. And it's really, really down the middle. So I just feel like it's just an overwhelming moment, and 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 that manifests itself in lots of different ways for families. Like some people come and I said it to my staff, some people are going to come screaming and yelling and hooting and hollering and just say, oh, my goodness, it's so much for everybody. And people just want to be heard. And so it's just like trying to meet everybody where they're at. And then when you find out there's an issue, can we connect them to a resource to help and support them? Is how we've been thinking about it.
Can I ask you a question, Peter? I'm just
Sure.
jumping out of turn here.
Karen.
Like, one of the things that I'm just now thinking about as you speak is how do we support the principals? Because at the end of the day, you're absorbing everybody's issues. And so how does the principal swim through these muddy waters as we open up in September? And even now.
Yeah. That's no one ever asked that question. I didn't think you were going to go there, Karen. But so first of all, is not to, you have to realize principals are people too, and I have to be very honest. Like we have to hold principals accountable. Like I have to be very so they're people. They're dealing with a pandemic. They're dealing with loss. Everyone's going through stuff. In my family, other families, there's loss and stress all around. And that's manifesting itself in lots of different ways. But at the end of the day, when I see some of our numbers coming back, principals really have got to have an inviting environment back for their kids. Like, so how can we support our principals? I don't have a great answer to that. But actually, I don't know if we're letting. If I see that 10 or 15% of kids are coming back in a school community, I don't know if they've been actively encouraged to come back. And I'm telling you, in talking to hundreds of families, there's a need out there. So creating a welcoming environment is really, really important. What else do principals need? It's like, teachers are, I can't tell you, one of the greatest leadership challenges I've had, Karen, in my recent years, we've known each other for years, is the process of leading the faculty to opening March 1. And where we were in January when we made the decision, there was so much stress, anxiety, like it was literally the 7 stages. There was denial, there was anger, there was depression, there was all that about and loss, but we got to put one foot in front of the other, and we're here for kids. And that's even hard to say in this moment. Our teachers are there for kids, but they were so stressed about themselves and their family. And so the social emotional learning needs of our teachers who are going to be on the front line. So what is the mindfulness we're doing with teachers? What is the social emotional needs that they're being met? So part of our professional development is working on their development, right? So, but we got to lead in this moment, right? Like if I listened to where everybody was in January, we wouldn't have any kids in the building right now. But now the teachers are in a different place, and they, and it's just but helping them deal with their stress is the biggest stress for me. They're putting it all how can we help and support teachers to not say, oh, I'm not going to teach, but to get through this moment would be the best thing to help principals, because it's been really stressful on that strand.
That was a great question, Karen. And I appreciate you talking about all of the stressors for the teachers, because I think, when we look across schools with variable rates, you have principals who have been put in this position of, trying to meet the needs of families and meet the needs of their staff. And outside of professional development and, trying to alleviate some stress in the teachers, which we know is probably not able to take all of this away, what else would you share for other principals in terms of how to walk that line? Sorry, I keep putting you on the spot, Peter.
Oh, wait, okay, well, I thought you were, I'm sorry, say the question one more time, and I'm ready. I thought you were sharing.
No, I just want to like your words of advice, words of wisdom to other principals who are trying to like walk this line between teachers and families.
Yeah, number one is hear from everyone. And sending out a survey via your email is not a way to find out from every family. So we had a comprehensive approach. We have a tracker. You could look at it right now. I would know exactly how many times someone's been contacted, including number of phone contacts, number of emails, and home visits if we haven't heard from people. Like, it's not acceptable to not hear from everyone. And then empower our parents to make a choice for themselves. That to me is like, so then it became very clear to me, like, because I love my staff, but like, and they were on board too, but I have 50% of my families saying they want to come back, guys. We're doing this. It's not now, like, so let's figure out how to do this safely for everyone. But I just feel like, and it's really hard, I get it, but there's social media, there's other ways, there's creative ways to know how to reach every family. And I can't tell you. And anyway, when I hear certain things, anyway, I could go on about the political nature and like, the people, I just don't speak for our families. Let them speak for themselves. Every one of my families had the right questions. They were worried about safety of their kids, their students, their children, and they were with their families, but they were balancing what their needs are. They were doing the same thing I do as a parent, and just empower them to make that decision, but hear from every family.
I was going to add one more thing, is just that when things are normal, if and when that ever happens again, the other thing that is really critical is to have the teachers lead, because you can't be the only leader in the building. You're going to get trounced if you take that attitude. And I do see that too many principals are, kings, queens, mayors, whatever, and that doesn't. Then when the power is shared, so are the problems, for lack of a better way to put it. But so are the solutions. Like, if you put all heads together to bring about solutions, the solutions are so much better and so much tighter and also sustainable. So empower the parents and give the students voice, and also have the teachers be teacher leaders.
Thank you. I want to shift gears a little bit and ask you to reflect on a question that came in from the audience, and that is thinking, projecting out to the fall, which I feel like is probably what we all need to be doing, but very difficult to do right now in education. But thinking about the fall and a return to school, where does play and sort of joy come in that equation, particularly for the youngest learners, but for all learners? I've got a middle schooler and a high schooler, and they also want play and joy in their schooling as well. So if you all could just reflect on where you see that in the planning for the fall.
I just spoke, so I was going to have someone else go, maybe Holly.
Sure. No, I think that there's people feel kind of intense now too, like we need to make up for missed learning opportunities. But I think it's probably ideal to be able to step back, to ease in and not be worrying so much. I mean, the learning loss is important, but having a sense of, recovering from all of this and getting back to normal, it's an adjustment. And so, what to do exactly, I'm not sure, but easing in a little bit and not worrying so much about the learning loss piece of it that seems to be so much on everyone's mind.
I just want to say I got a communication from a friend in a different district who said that they're walking back into full-on tests. Like the students are walking right into 4 weeks of testing, which is absolutely insane. So that's the opposite of what we want to do. But then when we think about sort of the bare bottom line, like how do you put really young people together, socially distanced, and have them experience joy? Because they're still in a phase where, you know, they hug each other, they touch each other, they roll on the floor. And so I think that piece of the joy depends on where we are with vaccinations. Will we decide that the youngest people actually don't need them? Will we have it expanded down to age 8? You know, I think that the science is going to dictate a lot of how much joy we're able to really have in a classroom, especially with some of our youngest learners.
Yeah, I would just say this is so important, just because, like, for lots of, I mean, just like enjoyment, engagement, joy, like active participation. And so, but we're doing it now. Like, we don't have to wait for the fall. Like, if you came to my school, like, yes, kids are working in lines and they have their masks on, but like they get outside every day. I was double Dutch. I did my first ever jump roping with like, you can do hula hoop. We have structured recess where they actually have games they play that are socially distanced, and you can throw a ball. It should be outside time. All the middle schoolers and the upper, we have the 5th graders back early. All they want to do is talk and be social. Let them talk and be social. And absolutely. But then at the real level is like getting back to the idea of having teacher leaders and training on social emotional learning and a forum and a curriculum to actually have conversations with. So like that's so important. Like that there's a structured time every week where they talk, and follow-up times where they talk through with the class. Like it's really important to foster the interaction. And teachers are masters at this. I mean, let them loose, building community within their school with their kids and getting them to we also do something called, it was Fun Fridays, because Fridays we let them out a little early, and there was an hour where teachers got to do whatever they wanted to do with kids, and kids got to vote on what they wanted to do. Cooking class, dance party, chill out, listen to music. Like that shouldn't be seen as like believe me, there's pressure on us to move scores. I get it. But if our students totally disconnect, we don't have a chance. We got to re-engage them. So I think this is a central piece. And it's fun. Like, why not have fun while we're doing this work? Like, let's like, it's too stressful. Let's build that in.
Thank you. Yeah, I agree with you. I think that, you know, joy is what we like experiencing in schools, right? You want to walk into a school and you want to feel the warm climate in the school, and you want to feel the joy of the students. Before we go to just final remarks, I do want to give you an opportunity, just either from a systems level, from the research level, from the school level, that if parents feel like their child is experiencing a mental health crisis because of the pandemic, who do they go to?
If it's a safety concern, they should go to the emergency department. If there's risk of that person hurting themselves or someone else, that's a black and white situation, and they should go to the hospital.
Thank you, Holly. And at the school level, do you, Peter, do you have
We have a whole process and protocol of like the black and white is that's exactly what we do, or there is a protocol that trained professionals go through to see what type of ideations students are having and families are having, and that would trigger immediately. I mean, right now when we're on Go Guardian, we're monitoring every student on their computer, and when we get pinged by the district if a student is doing a search around harmful nature, let's say. And the big thing is not to take any of this lightly. This is real. And like we have a like critical response team where we get to the heart of it, and then the right professional goes through with the child if they can, if not the parent, to notify I mean, Miss Wilcox will know the questions they ask, and then from there it's like a tree, like to determine what type of resources they get. The big thing for me is this isn't swept under the carpet. If something gets raised up and there's a comment made, we have to take it super seriously, and then lean on professionals either in the building to help us guide us through the process. Social worker, guidance counselor, they'll know the steps to take, and then connect to resources.
Thank you.
I was just going to say a couple of things, which is try not to leave the parent out of it, because there are times when the parent has no idea, and the next thing they know, the child is in the hospital and they're just freaked out completely. And the other thing is that because school is home and home is school, I think everybody should have on hand the Suicide Hotline, because suicidal ideation is a reality, and it's astonishing how real it is and how frequent it's happening. And that hotline really does lend support. And the other group that I know still works with the school system is BCARS.
Yeah.
And I have no idea what they stand for. I'm sure Holly does. But so if they are brought into a crisis situation, they also provide continuing support, which is what is critical. Too often, I recall being a principal, and a student would have a crisis. The crisis is so-called handled. The child is hospitalized. They come right back to school with no support, no nothing. So that's just setting up a disaster for the child and whoever else is involved. So those are my couple little points on that.
Thanks.
Can I jump in? I'm sorry.
Yeah.
Some schools, what they do is on the student ID cards, or they give out cards to students of the crisis text line and the crisis hotline. And nationally, we're all going to be using 988. We're all each state is moving in that direction. So it's an easier number to remember than the suicide prevention lifeline, which is, 10 digits. And so we're working in that direction, but thank you for mentioning those resources.
And
The thing I wanted to jump in is to Karen's point and Holly's. This is my third year as a principal. I've been shocked about the suicidal ideation and how young the kids are having it. It's not an adolescent and high school thing. It is, we have to have our hands on the pulse. And it's been one of the most challenging things I've had to deal with and learn how to work through as a principal. But it starts really young.
thank you all. I know this is a really serious and heavy subject, and I appreciate you all giving the urgency to it that it needs. I do want to wrap up because we're close to time, and I want to give you each an opportunity just to leave us with some parting words of wisdom. I think, we've talked about this a few times today, whether we like it or not. Virtual learning is likely to stay with us in some form as we move forward. And I would love to hear just quickly from each of you. We'll start with you, Holly. What do you think we need to do as we head towards the fall to build our schools back better in terms of a safe and nurturing and calm environment for all of our students?
And I bring a mental health perspective to this, so my response will probably be a little bit different. But of course, I'm thinking of this in the transition back. It will, like Peter was saying, it's ideal to have evidence-based programming in place where students have the opportunity to debrief and to talk about these situations. A lot of this, and Beth, you know this because you and I work together on things, a lot of these programs that are intended to help students out have been put on hold during virtual learning because they're unsafe to do in a virtual context. So trying to think about integrating into health education class and other opportunities we have to do some programming to debrief and to acclimate students back into school is really ideal. And there's a lot of good evidence-based programs out there. I'll stop there. Thanks.
Karen?
I guess I wanted to just say another word about restorative practices and say that we have developed a report that we can link to you guys and you can maybe send out to the audience. It talks a little bit more, it talks a lot more about what restorative practices is. I do want to say that we did an evaluation of 14 schools. We saw a 44% decrease in suspensions in a one-year period after those schools learned how to be restorative instead of punitive. I also want to say that Open Society Institute Baltimore funded these projects early on, and now the school system has adopted them. The problem, of course, is that these things take time. So unfortunately, not every single school is a restorative practices school. I think when we see that happening, we'll see a totally different district. And I already have just really positive feelings about how that's being planned into the school year as we move into September. But the bottom line is, if we don't have principals like Peter Kannam, we won't have schools like Peter Kannam's school. And that's the bottom line. So this idea about holding the leader of the school accountable and bring in the right leader, bring in the leader with the right heart and mind, or else you're not going to have the results that you seek. And so those are my parting words.
Thank you. Peter, we're going to
Yeah.
give you the last word.
Oh, that's really nice. And thank you for the opportunity to participate in this panel. I think one of the themes that has come up in our conversation is this isn't an add-on. This needs to be part and central of what we address in a school. The mental health supports, the social emotional learning, especially during it should have been already, but now even the pandemic, it's exacerbated, right? Like, so like what we need to do is like, I control a budget. School systems control budgets. Schools have resources. We are getting money around the CARES Act funding. We need people. We need people in buildings that have expertise that kind of support this work. There is training that can be invested in for staff. There are people, staff positions that could be like whether it's as a guidance counselor, a social worker, a full-time mental health clinician that should be in buildings. And advocates should hold school systems and principals accountable for building that into their budget. It's not an add-on, it needs to be central.
That is a great last word to this conversation, to underscore just the need for supports we have in our schools. So again, I really want to thank all of you for joining us this afternoon and for this insightful discussion. I really enjoyed being able to talk to all of you. I also want to give a big thank you to our entire eSchool Plus team who worked tirelessly behind the scenes to bring this project to fruition. As a reminder, the Johns Hopkins University eSchool Plus initiative is a collaboration between the Consortium for School-Based Health Solutions, the Berman Institute of Bioethics, and the Johns Hopkins Schools of Education, Medicine, and Public Health. And last but not least, I would like to thank you, our audience, for joining us this afternoon. My name is Beth Marshall, and it has been a great privilege to serve as your moderator today. And we look forward to continuing the conversation in the future. Thank you again for joining us.
Thank you all.
Thank you.